Indian dads throughout the nation are super perplexed. Happy, pleasantly surprised, but also perplexed. For decades, the kids who never came to them and spoke or expressed their love suddenly are going to each of their dads and saying, "I love you." This was because a challenge issued by one of the content creators, a stand-up comedian, an artist, and an amazing storyteller, Mr. Samay Raina.
इट्स अ फकिंग स्क्रैच कार्ड हमारे पापा का हार्ट. मैं बता रहा हूं, आज के आज घर जाना, कॉल करना पापा को, बोलना पापा आई लव यू बोलो.
And I'm so happy that he encouraged all of them to wish their dad. But I would, as a doctor, I would like to take this one step further and ask all of you to talk to your dad and ask them two particular questions. Dad, do you sleep well in the night? Any issues? Do you have to get up repeatedly? And is there any problem with respect to urine issues or peeing? Well, you might feel very strange. Why all of a sudden, as a doctor, there can be so many things about health that we can ask. Why are we talking about urine health and sleep cycle or sleep quality? Well, the answer lies in a male walnut-sized gland, which is known as prostate. We have one organ, all of us males, which grows throughout our life and doesn't stop. And that is where the problem lies. And this gland is known as the prostate. And this condition where the prostate, because it's growing with time, after a certain period of time, certain middle age, starts pressing upon the urine pipe causing urine issues, is known as benign prostatic hyperplasia. Without confusing you too much, let me introduce myself first. I am a board equivalent certified interventional radiologist, Dr. Gaurav Gangwani. And for years, I have been treating enlarged prostates and middle-aged to older males with minimally invasive angiographic techniques, and that's why I'm speaking on this topic. So let me break down this whole condition which we introduced into various segments, and let us talk about this now. Do watch till the end or skip till the end when we are going to talk about prostate embolization, a minimally invasive techniques without any blades, sutures or scars, which the patient can be treated without removing his pants, local anesthesia, daycare basis within 4 hours out from the hospital. But yes, let's start from the basic. First, what is the prostate? Prostate is a walnut-sized gland located at the base of the urinary bladder. The urinary bladder leads to a pipe known as urethra, which goes right up till the exit for passing urine. And this passage below the bladder is encased or encircled by the prostate. This gland, while this gland is very important for reproductive health, it is the main gland that produces semen. Yes, sperm is produced by the testes, but the milky white fluid that we see gets produced by the prostate, and that is why it is important for reproductive health. The problem is that it keeps growing throughout age, because of which, if it grows beyond a point, it starts pressing upon the urine pipe that's passing through its center and causing a lot of problem, which we are talking about today. This problem, or the problem statement, is so large, so common, that 50% males above 50 and 90% males above 80 have benign prostatic hyperplasia and some of the symptoms to varying degrees. So with this, let's jump to our second topic. What is benign prostatic hyperplasia? As the name suggests, it's a problem of the prostate. Hyperplasia means the prostate is enlarging, growing, multiplying in cells and causing issues. And benign means it is not cancerous, so nothing to worry about. But yes, it is causing problems, and that's why you have to take it seriously and treat it. Albeit not like cancer, not critical or dangerous like cancer, but at the same time affecting the quality of life and causing a lot of morbidity. Why does this problem occur? Well, there are various causes or risk factors. Let's talk about the known common ones. Not that I'm claiming that medical science has completely understood this condition, but yeah, more or less. First, aging. It's a part of aging. Like I said, this is one gland which does not, one organ or gland in males which does not stop growing with age. It's a natural aging process also. 80-year-old prostate usually average would be much larger than a 20-year-old prostate. Second is hormonal changes. Yes, this is the biggest factor influencing, and we have seen how low testosterone and higher dihydrotestosterone and estrogen levels due to enzymatic issues can cause prostatic enlargement. Third is genetics. If your father had it, your grandpa had it, your elder brother has it, chances are you might have it. Lifestyle does play a role. Obesity, lack of movement, diabetes type 2, all these factors are known to cause this. That is why diet, exercise, movement have big roles in potentially targeting apparent reversal. Now jumping to what are the main symptoms, or how does a patient present if he has BPH? Well, the main symptoms by which a patient would present are: first, urgency. When they get a urge to pee, they feel they cannot hold it and they will leak it, so they have to rush to the washroom. That is why many of these individuals do not take long journeys or take precautions whenever they are outside, sometimes drinking less water. Second, when they do get the urge to pee and they reach a washroom, there is hesitancy and difficulty to start urination, to the extent that many times they have to strain for doing it. Third, once the stream starts, it is super weak to the extent that sometimes it starts and stops intermittently multiple times throughout. And still, towards the end, the urine is not completely empty and they feel that there is a lot of residual urine in the bladder. It's not completely emptied. So there is incomplete emptying. And lastly, because there is incomplete emptying, they have to go repeatedly. There's frequency of urine. Daytime still acceptable. Many times, nighttime frequency is the biggest problem and deterrent, because of which patients have to keep getting up every few hours and it completely jeopardizes their sleep and they become irritated throughout the day. Now that we know what are the symptoms, what do you do if you have these symptoms? You have already self-diagnosed that I have BPH. Well, you go to a specialist, usually a urologist, but today interventional radiologists also see this condition, where both of them do similar kind of history taking and examining. The history taking starts with a IPSS score, an International Standardized Prostate Symptom Score, where they ask you 8 questions and form a score and understand how severe this condition is. It also acts as a baseline to compare after treatment how well it's reducing. Then they do a digital rectal examination most of the times. We get a sonography done which tells us the prostatic size, any other lesion there, what's going on after passage of urine, what's the kind of urine that retained inside, is there residual urine remaining. And finally, sometimes we do a uroflowmetry where we ask you to pee in a pan which has a pressure sensor and it tells us what the kind of urine flow or pressures are. With all these tests, of course, sometimes blood tests like PSA levels and urine tests, we have a final picture in mind, and based on this, with few exceptions where we do some advanced tests like urodynamic study or MRI, we can proceed for management planning. What's the treatment? It's plain and simple. The early stages, mild symptoms, you can leave it or give some simple medications like alpha blockers which relieve spasm and improve urine flow, or 5-alpha reductase inhibitors which take care of the enzymes and the hormonal imbalance to reduce prostate size, as also cause some shrinkage over a period of time, of course. But if it's enlarged beyond a point, you have to think about intervention or surgery. The gold standard treatment, intervention or surgery is TURP, transurethral resection of prostate, where a urologist takes in a device, a camera through the urine pipe, natural orifice, sees the enlarged prostate, tries to shave off most of it, at least that part which is jutting into the urethra, urine pipe, and clears urine. But this does have some consequences in a selected patients. There is anesthesia, there's operative stay, there's recovery period. There are issues like sphincter disturbances, occasionally urinary strictures or urethral strictures, and biggest dreaded complication, retrograde ejaculation or erectile dysfunction, which guys hate even at that age, because no male even at 50 or 60 would like to lose that kind of reproductive function or just the pleasure function, erectile function. That is where there has been a tendency or a trend to try minimally invasive options. Most of them were urological, same route, same passage, holmium lasers, urolift, resums, mist, and many such options. But now we have the king of all minimally invasive interventions, which has nothing to do with the urine pipe at all. It's known as prostate artery embolization. Well, let's jump into the history, how this procedure formed and what this procedure is. For decades, there was always a problem that when they did TURP, some patients, the same age group, were on blood thinners, which you cannot stop immediately because there's a heart stent, there's a bypass that's done. So you need to take care of the prostate, but the patient is on blood thinners. You need to operate, but the patient is on blood thinners, potentially causing problems. Bleeding prostates are not the best. If there is hematuria already bleeding, it jeopardizes the vision and causes issues during operation. Sometimes prostates are too large beyond the scope of TURP. Sometimes patient has so many comorbidities, anesthesia, and it's not easy. That's where they involved the interventional radiologist and asked them, can you do an angiography and stop the blood flow? We have seen you treating fibroids, we have seen you treating so many organs, hemorrhoids, thyroid, let's try this. And interventional radiologist did it with the intention to buy some time. Let's stop the blood flow, let's potentially try to reduce prostate size, give some time. Once patient is stable, off medication, or you can halt the medication, the acute cardiac status is better, patient anesthesia can be given, let's try a TURP then. But surprisingly, when they did this prostate artery embolization, they found that the prostate shrank and there was no need of doing a TURP. It was not only pre-operative but therapeutic and completely cured the prostate in most patients. That's when it started expanding and started becoming one of the first-line therapies. The main problem was still lack of awareness in becoming the first line. That was the biggest bottleneck, and till today is the patients still go to a urologist first, and that is why many times this is not even offered as an alternative, at least as a first line. But with so many countries now producing level 1 evidence, meta-analysis, randomized trials, paper after paper, including 5-year follow-up data, 10-year follow-up data coming in from Brazil, USA, Europe. Now urologists were forced to include the prostate artery embolization as one of the first line options in American Urological Association guideline, despite trying to resist it for decades now. And mind you, in most Western countries, it is becoming almost the first line treatment when compared to TURP. So with that, just to summarize these trials, they say that the results are almost equivalent. Yes, on uroflowmetry or pressures might be mildly lower, but clinically they are equivalent with lesser number of symptoms. For long period of time, maybe TURP fares better in terms of recurrence, but even that gap is reducing with time and better hardware and more skill set and experience. In India now, so many centers have become high volume centers and doing loads and loads of cases and amazing results equivalent to global results. I don't want to just introduce this topic and leave it. There's so much to talk about how it's done under local anesthesia, OPD or daycare basis, minimally invasive, rapid recovery, no suture, no scar, you don't even need to remove your pant. But rather than covering everything in this one short video, the intent of which to introduce prostate problem for you, let me give you a few videos on end screens which you can see and understand the condition and the treatment plan. Of course, don't forget to subscribe and press the bell icon because we are going to be talking a lot more about this so that you can choose this treatment or at least know about these treatments in future. Ending the video on this note, stay safe, stay empowered.